Now we will get into the details of the musculature of the hand. The intrinsic muscles of the hands serve the function of adjusting the hand during gripping and also for carrying out fine skilled movements. The intrinsic muscles of the hand are the thenar muscles, hypothenar muscles, lumbrical muscles, palmar and dorsal interossei, adductor pollicis, and palmaris brevis. Let's look at these muscles one by one, starting with the thenar muscles. At the volar surface of the hand, we can see a sort of mound on the radial side just at the base of the first digit, that is, the thumb. This prominence, or the mound of the flesh, is known as thenar eminence. The thenar eminence is made up of three muscles: the opponens pollicis, flexor pollicis brevis, and abductor pollicis brevis muscles. These muscles are associated with opposition of the thumb to the fingers and flexion and abduction of the thumb, and are responsible for the prominent swelling, thenar eminence, on the lateral side of the palm at the base of the thumb. If we look closely at this muscle, we can see that these three muscles are innervated by the recurrent branch of the median nerve. Let's jump into some details about these muscles, starting with deeper muscles. Opponens pollicis. The opponens pollicis muscle is the largest of the thenar muscles. Originating from the tubercle of the trapezium and the adjacent flexor retinaculum. It inserts along the entire length of the lateral margin and adjacent lateral palmar surface of the metacarpal one. We have already mentioned that the muscle is innervated by the recurrent branch of the median nerve. The action of this muscle is the opposition to the thumb. The opponens pollicis rotates and flexes metacarpal one on the trapezium, bringing the pad of the thumb into a position facing the pads of the fingers. The next thenar muscle is the abductor pollicis brevis. The abductor pollicis brevis muscle overlies the opponens pollicis and is proximal to the flexor pollicis brevis muscle. It originates from the tubercles of the scaphoid and trapezium and from the adjacent flexor retinaculum and inserts into the lateral side of the base of the proximal phalanx of the thumb and into the extensor hood. Supplied by the recurrent branch of the median nerve, the abductor pollicis brevis abducts the thumb, principally at the metacarpophalangeal joint. Its action is most apparent when the thumb is maximally abducted and the proximal phalanx is moved out of line with the long axis of the metacarpal bone. Lastly, we have the flexor pollicis brevis. This muscle is distal to the abductor pollicis brevis. It originates mainly from the tubercle of the trapezium and adjacent flexor retinaculum, but it may also have deeper attachments to other carpal bones and associated ligaments. It inserts into the lateral side of the base of the proximal phalanx of the thumb. The tendon often contains a sesamoid bone. The flexor pollicis brevis flexes the metacarpophalangeal joint of the thumb. A good way to remember what muscles are in the thenar eminence is to associate them with meatloaf. The capitalized M in meat is for the median nerve, which supplies all three muscles. The thumb, or the thenar eminence, is on the lateral side of the hand. So L is for the lateral aspect of the hand, so you don't confuse it with the hypothenar muscles that we will read about in a short while. As for the OAF, O is for opponens pollicis, A is for abductor pollicis brevis, and F is for flexor pollicis brevis. Moving on to the next group of intrinsic hand muscles, the hypothenar muscles. The hypothenar muscles contribute to the swelling, or the hypothenar eminence, on the medial side of the palm at the base of the little finger. These muscles are the opponens digiti minimi, abductor digiti minimi, and flexor digiti minimi brevis. The hypothenar muscles are like the thinner muscles in name and in the organization. The major difference is that, unlike the thinner muscles, the hypothenar muscles are innervated by the deep branch of the ulnar nerve and not by the recurrent branch of the median nerve. Starting with the deeper muscles, let's go into some specifics regarding these muscles. Opponens digiti minimi. The opponens digiti minimi muscle lies deep to the other two hypothenar muscles. It originates from the hook of the hamate and from the adjacent flexor retinaculum, and it inserts into the medial margin and palmar surface of the metacarpal 5. Its base is penetrated by the deep branches of the ulnar nerve and ulnar artery. The opponens digiti minimi rotates metacarpal 5 toward the palm. The movement is much less dramatic than that of the thumb. This muscle is responsible for pulling the fifth metacarpal, as in when cupping the palm. Next, we have the abductor digiti minimi. The abductor digiti minimi muscle overlies the opponens digiti minimi. Here is part of its cut to show the underlying muscle. It originates from the pisiform bone, the pisohamate ligament, and the tendon of the flexor carpi ulnaris. It inserts into the medial side of the base of the proximal phalanx of the little finger and into the extensor hood. Supplied by the deep branch of the ulnar nerve, the abductor digiti minimi is the principal abductor of the little finger. The third hypothenar muscle is the flexor digiti minimi brevis. The flexor digiti minimi brevis muscle is lateral to the abductor digiti minimi. It originates from the hook of the hamate bone and the adjacent flexor retinaculum and inserts with the abductor digiti minimi muscle into the medial side of the base of the proximal phalanx of the little finger. The flexor digiti minimi brevis flexes the metacarpophalangeal joint and is also supplied by the same nerve. That's all about the three muscles of the hypothenar. The next group of muscles in the intrinsic muscles of the hand are the lumbricals. There are 4 lumbrical, worm-like muscles, each of which is associated with one of the fingers. The muscles originate from the tendons of the flexor digitorum profundus in the palm. A muscle that originates in the forearm and its tendon is inserted into the hand. If we zoom in just a little, you can see here. The medial 2 lumbricals are bipinnate, meaning a muscle wherein the muscle fibers or fascicles are on opposite sides of the central tendon. These lumbricals originate from the flexor digitorum profundus tendons associated with the middle and ring fingers and the ring and little fingers, respectively. The lateral 2 lumbricals are unipinnate muscles, originating from the flexor digitorum profundus tendons associated with the index and middle fingers, respectively. That was the origin of these muscles. If we look at the insertion, it's a bit more complex. To better visualize the insertion of these muscles, let's look at the lateral view of the digits and revise some of the basic concepts. Here we see the metacarpal, proximal phalanx, middle and distal phalanx. Here, between the metacarpal and proximal phalange, we have the metacarpophalangeal or the MCP joint. Then there is the proximal interphalangeal joint PIP and the distal interphalangeal joint or PIP. In this picture, you can see the lumbrical muscle and the extensor expansion. The extensor expansion or the hood is mostly present on the dorsal surface, but part of this hood crosses in front of the MCP joint. The lumbrical muscles move from the volar or palmar side to the dorsal side and are inserted into the extensor hood as shown here. Due to these unique insertion points, the muscle performs 2 types of actions. They cause flexion at the MCP joints and extension at the DP and PIP joints. You can say that through their insertion into the extensor hoods, they participate in flexing the metacarpophalangeal joints and extending the interphalangeal joints. The lumbricals are unique because they link flexor tendons with extensor tendons. Nerve supply. The medial two lumbricals are innervated by the deep branch of the ulnar nerve. The lateral two lumbricals are innervated by digital branches of the median nerve. Now let's talk about the interossae. Interossae is a Latin word that means between the bones. The interossae are muscles between and attached to the metacarpals. They insert into the proximal phalanx of each digit and into the extensor hood. They are divided into two groups, the dorsal interossae and the palmar interossae. All the interossae are innervated by the deep branch of the ulnar nerve. Collectively, the interossae abduct and adduct the digits and contribute to the complex flexion and extension movements generated by the extensor hoods. Let's look at the two groups of interossae in more detail. Dorsal interossae. Dorsal interossae are the most dorsally situated of all of the intrinsic muscles and can be palpated through the skin on the dorsal aspect of the hand. There are 4 bipinnate dorsal interosseous muscles between and attached to the shafts of adjacent metacarpal bones. Each muscle inserts both into the base of the proximal phalanx and into the extensor hood of its related digit. The tendons of the dorsal interossae pass dorsal to the deep transverse metacarpal ligaments. The first dorsal interosseous muscle is the largest and inserts into the lateral side of the index finger. The second and third dorsal interossae insert into the lateral and medial sides, respectively, of the middle finger. The fourth dorsal interosseous muscle inserts into the medial side of the ring finger. As for the action of these muscles, in addition to generating flexion and extension movements of the fingers through their attachments to the extensor hoods, the dorsal interossae are the major abductors of the index, middle, and ring fingers at the metacarpophalangeal joints. The middle finger can adduct medially and laterally with respect to the long axis of the middle finger, and consequently has a dorsal interosseous muscle on each side. The thumb and little finger have their own abductors in the thenar and hypothenar muscle groups, respectively, and therefore do not have dorsal interossae. The radial artery passes between the two heads of the first dorsal interosseous muscle as it passes from the anatomical snuff box on the posterolateral side of the wrist into the deep aspect of the palm. Now let's talk about the second group of interossae, palmar interossae. The 3 or 4 palmar interossae are anterior to the dorsal interossae and are unipinnate muscles originating from the metacarpals of the digits with which each is associated. These muscles are inserted into the proximal phalanges as well. The first palmar interosseous muscle is rudimentary and often considered part of either the adductor pollicis or the flexor pollicis brevis. When present, it originates from the medial side of the palmar surface of metacarpal 1 and inserts into both the base of the proximal phalanx of the thumb and into the extensor hood. A sesamoid bone often occurs in the tendon attached to the base of the phalanx. The second palmar interosseous muscle originates from the medial surface of metacarpal 2 and inserts into the medial side of the extensor hood of the index finger. The third and fourth palmar interossae originate from the lateral surfaces of metacarpals 4 and 5 and insert into the lateral sides of the respective extensor hoods. Like the tendons of the dorsal interossae, the tendons of the palmar interossae pass dorsal to the deep transverse metacarpal ligaments. The palmar interossae adduct the thumb, index, ring, and little fingers with respect to a long axis through the middle finger. The movements occur at the metacarpophalangeal joints. Because the muscles insert into the extensor hoods, they also produce complex flexion and extension movements of the digits. As mentioned before, These muscles are innervated by the deep branch of the ulnar nerve. A trick to remember the action of the two groups of muscles is the phrase PAD, DAB. The palmar interosseous adduct the digits, while the dorsal interosseous abduct the digits. There are two other muscles in the palm that are not lumbricals or interosseous and do not fit in the hypothenar or thinnar compartments. One is the palmaris brevis, which we already discussed when we talked about the superficial fascia of the hand. Let's go through it once again to revise it. Palmaris brevis, which we have discussed before, is a small, thin muscle found superficially in the subcutaneous tissue of the hypothenar eminence. Attachments. Originates from the palmar aponeurosis and flexor retinaculum, attaches to the dermis of the skin on the medial margin of the hand. Actions. Wrinkles the skin of the hypothenar eminence and deepens the curvature of the hand, improving grip. Innervation, ulnar nerve. The second muscle is adductor pollicis. As you may recall, pollicis is Latin verb that is associated with thumb. The adductor pollicis is a large triangular muscle anterior to the plane of the interossei that crosses the palm. It originates in two heads. A transverse head from the anterior aspect of the shaft of metacarpal 3 and an oblique head from the capitate and adjacent bases of metacarpals 2 and 3. The two heads converge laterally to form a tendon which often contains a sesamoid bone that inserts into both the medial side of the base of the proximal phalanx of the thumb and into the extensor hood. The radial artery passes anteriorly and medially between the two heads of the muscle to enter the deep plane of the palm and form the deep palmar arch. It is innervated by the deep branch of the ulnar nerve. The adductor pollicis is a powerful adductor of the thumb and opposes the thumb to the rest of the digits in gripping. So, to summarize, unlike the extrinsic muscles that originate in the forearm, insert in the hand, and function in forcefully gripping, power grip, with the hand, the intrinsic muscles occur entirely in the hand and mainly execute precision movements, precision grip, with the fingers and thumb. All the intrinsic muscles of the hand are innervated by the deep branch of the ulnar nerve, except for the 3 thinars and 2 lateral lumbrical muscles, which are innervated by the median nerve. So this ends our discussion on the intrinsic muscles of the hand. Stay tuned to sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.